No, you're fine. Good to meet you guys. So I usually like to start out with just a little bit of discussion to kind of talk about the specific things that you guys are most interested in. Let me share my screen here and move my GoToMeeting thing out of the way there. So the way that I usually demonstrate the software is to look at the scheduling module, then to talk a little bit about our OccMed specialized pieces, kind of what makes the OccMed EHR special and different from kind of urgent care, primary care. So I look at the employer protocols and things like that, and then I flip into the provider documentation, show several different options there. And then I look at the portals, the patient portal, the employer portal, and then kind of wrap up with a high-level overview of billing. Does that sound good, or are there specific areas that you guys want me to focus on rather than kind of what I've laid out there?
That sounds good.
Okay, perfect. All righty, so our scheduling module, everything within PrognoCIS is set up with a series of properties, hundreds of them actually, to make the software very flexible. Particularly with occupational medicine, no two practices. This is also suited for employers, so no two people utilizing the software in different databases utilize it exactly the same, particularly on the occupational medicine side of things. So a lot of what we do is very customized to fit your specific workflows. On the scheduling side of things, you can see multiple provider schedules side by side. You can see an individual provider's schedule for a day, a week. You can also set those views up by location, by several providers, depending on how your staff needs to schedule and what they need to see. All of the time increments, the colors of the visits, the color of the schedule template background here. So this blue is kind of the template, the gray is basically open time, where there's no schedule template, all very customizable. We can make it have different colors. We can make it have instructions for what types of visits need to go in each section of the schedule or each time increment. And then you can also do the same thing with the patient portal. So if you want to allow patients to self-schedule, you can dictate what types of visits and when those are available to be scheduled. Scheduling an established patient is super simple. You just double click the time slot that you want to schedule a patient in, start typing in the patient's name, and once you have chosen the patient that you would like to schedule, you will see a pop-up if they have any alerts within their encounter. You can determine whether you want those alerts to expire, so something that just pops up for a period of time, maybe during the next visit, and then kind of goes away. You can have those pop up at appointment scheduling, encounter, or billing. Once you have a patient who's set up with a specific employer attached, we also have employer protocol options, and that's kind of the next area that I'm going to get into to kind of demonstrate to you the power of these and how you set those up. So what this does is give us the ability to select what type of visit that patient is having, and based on that, a menu basically be added to the encounter. They can either be things that are ordered, they can be templates that need to be completed, they can be forms that need to be completed. Essentially, you say for this particular employer, for this particular visit type, these are the things that we need. You can remove them, so if there's something that you know they don't need, you can go ahead and take that off here. And once you say okay, once an encounter started, all of that information is in that patient's encounter ready for you. We also have several little areas of notes, so you can have specific notes for an employer. It can go into several different kind of layers of notes so that you can see things that you need to see regularly right there within the screen. Also on here, we have a reason area. So if this is an injury related visit, we can pop open this screen, see all of the complaints that we also have loaded in the complaint or HPI section of the system, the subjective area. You can tag ICD codes for those. So once we start going in and documenting, it's going to also build our coding for us. We also have a place to locate instructions. We have a wait list functionality. So if you have patients that are scheduling far out, you can add them to a wait list and then put a little report in this section of the screen, all the patients who want to come in sooner. And then we also have this handy dandy little search function, which gives you the ability to, instead of surfing through the days of the schedule, if you have multiple providers or locations, that can be kind of complicated. So you can come here and instead find the next available appointment, or find the next available appointment by a specific location, date, time, provider, so on and so forth. To schedule a new patient, very similar functionality, except for when you come in to schedule this visit, you click this little button, which is what we call our quick register button. And this gives you the ability to quickly put in their name and their date of birth, gender. You can also add an employer from the system and attach it to that patient at that point, which will then enable the protocols when you're finalizing the scheduling, and you can put in some contact information. So you can quickly get the patient scheduled and not have to put in their address, their insurance information, and all of that, just to simply get their appointment on the schedule. And then last little thing to note, I know that you guys have physical therapy, so something that is really nice on the physical therapy side of things is that we also have recurring appointments. So if you're setting up a series of say 12 visits weekly, Monday, Wednesday, Friday, you can come in here and say that you want this to go on for 12 occurrences, and once you do that, it will then put all of those additional appointments on the schedule for you. And then one last little point is we also have co-scheduled appointments. So if you have appointments that need to be scheduled with a medical provider as well as a physical therapy provider, you can co-schedule those visits as well, so it schedules 2 appointments at one time. Any questions so far? And feel free, guys, to jump in if you have any questions at any time, want me to dive deeper, anything like that. This is super, super casual. Alrighty.
I have a quick question.
Sure, absolutely.
My question is, we have, as of right now on our EMR system, we are able to see the schedule for various, different reasons that they're coming in. So if I have my PT, and then I have Dr. Quick's patients, and then I could also have another provider on our calendar that we're able to select appointments for, like LHI appointments that don't have to necessarily see Dr. Quigg.
Mm-hmm. Sure. We have resource scheduling. So instead of a provider's name at the top of the column, we can have, you know, a room like here's an OR, that sort of thing, or telemedicine visits separate. So you can have those on a separate schedule, and you can determine with these different views here how you want that to show up. So if you have a scheduler who's scheduling for 4 providers, these 4 providers versus these 2, you can determine whose schedule they see when they go into the screen. And once they log in, once it saves that for them kind of as a little preference.
Okay. All right.
Alrighty. In our patient demographic area, we have probably a ton more information than you guys will ever want to store, but there's lots of places for things. We have the basic stuff, name, address, telephone number. We do have automated text reminders that you can schedule when you want those to go out. Those can also be customized by the visit type. So if you have visits where you need to instruct them to fast versus not, those sorts of things, you can have those text messages be a little different. You can also send out reminder emails. We also have a little bit of bulk functionality with texting and emailing where you could send bulk text or email to a group of patients based on lots of different parameters. So for instance, if you have a day where you're closing because of inclement weather, you can send a text and an email to all the patients letting them know that you're closed for the day. And based just on the fact that they're scheduled for tomorrow. So a little bit of additional functionality there, but not quite ad hoc texting where you can have a one-on-one conversation quite yet. With texting, with messaging you can. We also have the ability, here's where we have our employer details. You can add notes within that employer, which also show here as well as in the schedule screen. You can break the employer further down by departments as well as occupation, statuses. And then we also have this user definable area. So if you have employers that need you to give them specific information, particularly on their invoice, then you can have different types of fields in here. And so we just have a few different types of fields loaded in here as demonstration of the different field types. You can also track the days off work here. We have a couple other different ways to do that, just depending on which is the easiest way for you. You can load their preferred pharmacy in this area. You can add a photo of the patient. You can also load other providers that are participating in the patient's care, so their primary care doc or who referred them to you if it was another provider. And then billing doesn't typically come into play on the patient's account on the occupational side, but we do have the ability to see a little aging here for that patient. If there is a balance outstanding, if you do happen to have a patient balance, you can click that little hyperlink and see their most recent statement. And then we also do have a copay collection area where you can log payments made at the front desk. I do have an OccMed clinic that collects some pre-employment drug screen money on the patients occasionally. So you can set up a little batch and collect payments that way. And we also have the ability, if you want to integrate a third-party credit card processing vendor to process those payments at the clinic through the copay screen, as well as to allow employers to make payments on the patient portal, which I'll show in a little while when we get to that. We also have the place to store their insurance information, view their eligibility. You can also run that as a batch functionality. So if it is commercial health insurance and the insurance company offers eligibility, we can schedule that to be run the night before or the morning of, so you can see that all the patient's insurances are active. And then we have case management, which gives you the ability to store a ton of different details for multiple cases for a patient. So if a patient has, let me go back into my other patient here who has multiple cases. So if a patient has multiple cases, you can tag those cases to a body part, and then you can attach that case to the appointment so that everything in here, the state of the accident, the dates, and everything that need to flow through on the claim automatically go from the appointment into the encounter and onto the claim. And that encounter type can specifically be set up so that it would be automatically set to bill as a work comp claim versus an employer invoice or that sort of thing. So we have a lot of ways to automate those pieces of it. And there's, again, some user definable fields in this area. And then we also have your typical information that you need to store: the state of the accident, the accident date or injury date. We also have places to store some contact information, so any attorneys involved, case managers involved, the employer contact, insurance adjusters. And then we also, if you do any personal injury, can store whether there's a lien on file. You'll see a little ledger in this area of all of the charges associated to this case, how much has been billed. You can add notes. And then you can also document when a case is closed so that you can see what cases are open, what cases are closed for a particular patient. So this works for both work comp as well as personal injury if you're doing any of that. So that is essentially kind of the scheduling and front desk. Any at a very high level, but any questions or anything so far?
I just had one quick question. When you're looking at all the UDF information that you have on there, is that individually entered, or is there a place where, is there another place where all of that information gets entered? Is it entered into that UDF?
So typically it would get entered by your staff as they're entering a patient. We do have some functionality if you need to import information from, your existing system. We do have some parameters on that. I know that I have a clinic who imported some driver's license numbers into this area rather than to our typical driver's license area because they need the expiration date. So are you looking for more of an import functionality or where the data gets entered?
No, I was just curious of where the data gets entered. Is it entered just the one time in that area, or is there another place that it would be entered in, or does it show up anywhere else?
It can show up in other places. So for instance, when we get into the encounter screen, we have a little band up there. So if there's details from here you need to see in there, so we can pull it from here, but this is where you would enter it. So we have the UDF on the patient register here, and then the UDF within the case management here. So the data would be input here, but we can both pull it into reports as well as show it in a couple other places if you need to see it elsewhere. Does that answer your question? Okay, I'm gonna assume and continue on unless anybody has anything else. Alrighty, so the next area I like to show is the employer protocol area because we have a lot of functionality there in terms of setting things up. So we have this configuration area, and it's a lot of information here, and essentially behind each of these little hyperlinks are groups or the way that we set up different things. So for instance, the encounter types, your visit types get set up here, and you get to choose what those are called, and within them you have lots of different parameters like how long it's going to be, what color that's going to be on the schedule. So we teach you during the implementation process how those pieces work and how to set those up yourself. Then on the employer side of things, we have our list of the different employer vendors here. So when you go into one of those or create one, there are several kind of sections of the screen. So this section up here is kind of the administrative piece. You have your address for the employer there. And then this area sets up the login information for the employer portal. So here we have all of the users associated to Aero Industries that have a login to the patient portal. We can also dictate what kind of access they have. So it's segmented by documents, which are your clinical information, billing, and then you can also give them the ability to maintain their own users. So if you want to allow them to add new users, departments, so on and so forth, you can. And then we also have employee management, which is different from users. So these are the users who can log in to see the portal, and these are their employees that are within the system. And you can use that for randomization. So if you have an employer who wants to maintain their own list of employees, and then you use that list of employees for randomization for them for a periodic basis, then that's where you can go in and give them the ability to add new employees. We don't have the ability to schedule visits on the employer portal directly, and Ramesh may have an update for us on that, but we think that that is within the next couple of releases on the employer portal. So it's something that's being worked on. It's just not quite available yet. And we'll look at the employer portal and kind of show you that as well. But within each of these, you can have different addresses and phone number, contact information for these folks. You can even have notes and see a history of when they were added, that sort of thing. If there's an employer that needs job codes, you can load those in here. Those can be pulled into the patients as well as into the invoices. And then here's where we set up our protocols. So these are the 4 different types of protocols that I have set up for this employer. And within each one, you can see that I have a combination of different types of things. So I have labs, I have procedures, and we'll talk a little bit more about that when we get into the encounter side of things. That's kind of a catch-all for lots of different forms and things like that. Physical examination that's specific, vaccine, so you can incorporate lots of different things, including radiology, all these kind of different areas, and then even have a note for each of those particular protocols. So if there's something specific you need the staff to see, they can see that there. We also have the ability to, if an employer doesn't want to log into the employer portal to look at records, you can use this medical review section so that when the encounter closes, it either sends an encrypted email or a fax to an individual. This can only go to one individual, but it can go directly to, it could be a group email. When the encounter closes, it will automatically send the information directly to this medical review person for this employer. So if they don't want to log in, pull their own records, you can automate sending those out. You can also do that with the invoices. The employer attachment area gives you the place to store your contracts if you want to, or if there's any kind of forms that you want to keep the original, you can store those directly within the employer. We have insurance details, which is going to be related to your work comp. So if you already know the policy number and the insurance based on adding the insurance to the patient, it's going to basically say this is the one you need. Here's our notes section. We also have the ability to say that for this particular employer, we only do certain types of visits. So if you want to restrict the types of visits that you can schedule for this employer, that goes there. And then all of this is related to the billing. So here we have the account for that particular employer. So we can come in here and see all of their previous invoices, their AR, all of that. So I don't even have to go to the billing section to see this information. I can come in here and any of those blue hyperlinks, I can click directly into it. I can then give instructions to the system for my specific billing. So for employers where you are billing pieces of it to the employer and pieces of it to TPAs, you can set the TPAs up in here. So if I have a employer that I'm going to bill the office visits to the employer, but I'm going to bill spirometry to Align and drug screenings to eScreen, by setting it up this way, if I have these types of codes plus additional codes, it's going to automatically split it into 3 claims for me and say that each of those codes are going to go towards those TPAs. So it's going to basically, without me having to add an additional insurance into the patient's encounter or anything like that, it will automatically split those claims. When you have work comp information, so if there are certain codes that are always going to go to the work comp carrier, those go here. And then if you have any that need to specifically go to the patient, so the employer doesn't want to pay for a service and that particular CPT code is going to always go to the patient, then you can put that there. So this kind of automates pieces of your billing related to both work comp and employer. We also have a little separate work comp area over here, which basically says push these to employer, not to work comp. So kind of the opposite of those. And then here we have our setup for the invoices. So you can group the invoice by different things. You can decide whether you want to invoice by patient or group it to department. You can hide the CPT code if they don't want to see it. You can set your invoice schedule, their payment terms, put a purchase order number on there if you want. And then if an employer wants a specific invoice format, you can have multiple different formats set up within the system and attach the appropriate one for that employer here. And then if they don't want to log into the employer portal to receive their invoices or make payments, you can also just send them the invoice by email and put the email address there. And then you can have as many different fee schedules as you want to within the system, or you can just have one employer fee schedule and give a percentage discount off of that. So however you want to set up your billing based on the CPT codes that you have loaded in that fee schedule, it will automatically put those charges at that particular fee when you see a patient who's attached to that particular employer. Any questions on that area? All right, I'll keep rolling. Alrighty, so provider documentation. So here is where we really get specific to fit your practice. This is the home screen for your providers as well as any other clinical users. So a little different from the schedule. However, if you have somebody who works both positions, most of these buttons up here as well as these over here give you the ability to see a lot of the front desk things. So you can pop open their address easy here and do a lot of those front desk functions like collecting copays or putting in alerts, seeing insurance information. Also on this screen, each user can have their own view. So here we have filters, which give you the ability to select multiple providers. So if you're a medical assistant who's rooming patients from multiple providers or multiple locations, you can choose whose schedule you see here. And then these columns give you the ability to come in and say, okay, I need to see the date of birth for every patient on here. And I want it to be the third thing in my list of columns here. And that will add in here my patient date of birth. We also have little, and it doesn't ever work for me in a meeting, but we also have, oh, there we go. We also have these little hover over tooltips that pop up, and you can control what goes into that list of information there. So if you need to see patient information really quickly, we try to make it so that you don't have to jump around to find things that are set up within the system. So one of the areas that's popular here is to pull information from the UDF to show in this area if you have something specific you need to track. Also on this screen, we have our patient form. So we have the ability to, within a patient portal, as well as what we call Pro Check-in, which is kind of a tablet-based system for having patients fill out forms, as well as you can have your staff come in here and fill the forms out manually. And then we also have a patient portal app. So any of those 4 ways you can complete patient's history information. We also have things like the patient portion of the DOT form that can go here. We have lots of different standardized screening tools and things like oswestry and different forms that we can pull into your system from our library. But essentially in this patient form area, what we do is take any intake forms that you would like to have the patient complete and give the patient the ability to do the data entry for you. So they put their allergies, their medications, their past medical history, any information that you need to collect from them. And when they put it in here and you save it and accept it into that encounter, it pushes that information to the area of the chart where it needs to go. And I'll show you in just a second kind of where that goes. We also have our reason for visit here, the provider. This is to kind of tell you where the patient is within the visit. So your room and your visit status, these are customizable. The labels, so if you want to have a, any specific stations that patients might be in that you want to kind of keep track of, you can dictate what color those are and what they say there. So, with the PT assistant or that sort of thing, you can kind of see where they are. And a lot of this will automatically change based on the type of user that you are. So if you're set up in the system as a provider, it will switch to with doc when you click into the patient. And then you only have to change it when you're finished with the patient. Then we have our visit type here, which again is customizable. And then this is one of my favorite areas. So this process status lets us know that there's something that has been put into this encounter that hasn't been completed. So here I have a medication that I forgot to e-prescribe. This one has a lab, a radiology, a medication, and a vaccine that I haven't completed yet. So this just lets your staff know that you've ordered some additional things that they need to take care of. And once they satisfy those, whether it's e-prescribing or e-sending the lab order, it will clear that and it'll just show up blank by the end of the day is the goal. And then comment here. So if you needed to remind somebody to get a urine sample before the patient left or something like that, you can add a comment to this screen and only the clinical staff can see it. It's not part of their chart. So first I'm going to show a little bit about the pre-employment physical, and then I'm going to look at work comp just to kind of show you the different ways that we set things up. So when you want to go to a patient's chart, you just click their name. And when you come into this chart, a lot of this is also very flexible. So this area at the top is what we call our patient band. And so this is an area, again, that's popular for specific things to be pulled into, like date of injury if it's a work comp. You can put specific information in here and kind of determine what you want to see here. So, you know, next encounter, if they've got a next appointment scheduled, things that you want to be able to glance at anytime you're within the patient's chart, and that information just stays there the whole time. Then we also have this table of contents over here, and you'll see that it ends down here and doesn't scroll down. And when I go into the next encounter, you'll see that there's more options there. So we can eliminate the options that are not applicable for that particular encounter type to really simplify your workflow. Also from this encounter screen, we have this area, which is what we call our face sheet. And this can have up to 16 of these little cells. And if you click on them, they'll take you into those areas. And so this is customizable by the user. So it's set up with these 16 cells, and then each user can kind of move these things around, stretch them for the areas that are important. And this is intended to kind of be an at a glance of the information that you want to see for a particular patient. So you can determine if you want to see some of the things that you've already filled out in their encounter, their vaccinations. We do have this health maintenance area, which is utilized a lot for surveillance examinations. So things that you need to see that the patient needs to be scheduled for. You can also send them reminders through the patient portal about those things, and then also generate reports for any patients that have things due. From here, you can look at the patient's document list. So think of this as their paper chart. So these are all the documents that have either been completed in PrognoCIS that have an output. So progress notes, procedure forms, things like that. We also, anything that gets scanned and attached to the system comes here. All of it gets OCR recognized. So you can actually come here and search for keywords and find all the documents with those specific words in them. And then you can also hover over different areas and see anything that is just for that specific category. So if I want to see all the messages about this patient, or I want to see all of their lab results, I can come here and hover over those categories and find just those specific things. And then I can also even put in different filters by everything with the specific diagnosis code, everything with the specific case, lots of different things in here that you can sort by to find information quickly. So from here, I have my kind of encounter documentation for that day. So if the patient had to fill out any forms, I can see those again here. I can accept those into the visit. Those do complete the face sheet if you want them to. So if you are having the patients put in information like their medications, family history, when you save those patient forms, it populates all the data there so that your staff doesn't have to go section by section adding that information. You could also have your staff use those forms for data entry as well. Just talk to the patient, add that information. It just makes for quicker data entry than going into each specific screen and adding that information. So from here, for pre-employment type things, we have a couple of different documentation options. So in our OccMed section, this is kind of and this can be labeled whatever you want to call it, but essentially this is a catch-all for everything that is kind of outside of a normal office visit, I like to say. So it can be things like questionnaires. So if you have a specific questionnaire you want them to fill out related to this employer, they can fill it out in the patient forms, and then it'll come over here and be a form for you to be able to see while you're documenting. We can also have specific templates and things that you need to complete based on the employer's protocols of what they want you to do. So this one just has a quick physical and agility screen, a hearing in it. And if you don't want it in a big long template like that and you want each thing to have its own output document, so each of these have their own page in the document list. So if you want those to be separate, they can be separate templates here and have separate document outputs. So lots of choices on that. We have a big library of standard templates, which also include a lot of things like the DOT, and I'll show you a little bit about that in just a second. But a lot of different content in here, and then we kind of tweak these to fit your specific needs. And in fact, editing the templates is super simple. You just double click on the element that you want to edit, and you see the choices there. You see the way that it goes into the progress note. You can see the different type of field that it is, and we teach you or any kind of super users that you want to be able to edit your own templates, how to kind of set those up and edit those for you. And then there's also complete control on the output of the document. Do you want it to look kind of like a paper form did with check marks for everything, or would you like it to be more of a narrative note? So lots of choices on how those things are set up. And again, you have the standard library that you can take and tweak, or we can create your own from scratch. The other option that we have for data entry for your office visits and things are what we call doctor forms. And so if you already have forms that are formatted that you like the look of, that have all the information that you want, this is basically the same template that we were just looking at, but in a doctor form format. So you can put in multiple different areas of the system, vital signs, allergies, any information that you want to, visual acuity. This is a physical examination area. And then there's even some place to put comments and notes, and it pulls the provider signature. So we can take different parts of the chart and combine it into a form that then has the output that you want to. So if you prefer to document in something like this, then we can create those doctor forms for you. These are not easily editable after we create them. We have to edit those for you. So just kind of depending on whether you are kind of set in what you want versus things that you think you might need to tweak, very often that kind of helps people make the decision which they prefer. On the DOT side of things, we also have a similar functionality. So for DOT physicals, we have the doctor form, which looks really familiar. I was in an OccMed clinic a long time ago, and our papers were in triplicate, and they were like 18 by 24 inch sheets of paper. But this looks very similar to those old forms. Then we also have the certificate that you can complete in here, and a lot of this can pull the provider's certificate number and all of that information into the actual document, which then stays in the document list. You can share it in the portal, you can print it off and give it to the patient. You can even format the print output to the little size for their card. And then if you don't want to do it in the doctor form, we also have the DOT templates within the system. So if you prefer to fill out one big long template, this is all of those exact same fields, but in template format. So whether you fill it out here, whether you fill it out there, the output document is the same in the document list. It's just a preference of how you put that information into the system. So that's pre-employment and DOT. And then on the work comp side of things, we have more of a kind of traditional workflow is standard, where you are kind of doing things in a SOAP note format. So you'll notice that our table of contents has more options over here. This is kind of a blended version of the clinical staff plus the provider workflow. So typically your staff's going to put your vitals in for you. We do have a matrix where you can see their trended weight or blood pressure or such and such visit over visit. We can also put this on your face sheet, so you can kind of skip having to come to the screen. Your staff puts it in, you just view this little box back on that face sheet that had the 16 grid items on it. And then from here, we have these little green arrows. And so these take you based on the visit type in a specific order. You get to determine what that is, and it can be different for different people. And it'll take you from screen to screen. So this is our complaint screen, our subjective screen. This is that same list that was available in the scheduling area. So when I added that this was for an ankle injury, it kind of told me which one I needed to pick here. So I came in here and searched for my ankle foot injury. It's going to add this ICD code to my encounter automatically. And then from here, I have lots of different elements. And essentially, this is generally utilized so that your clinical staff has guidance on what they need to ask the patient and what data you want to complete. This has a ton of information. Not everybody wants to gather all this information. And so we can minimize this if you don't want to quite gather that, or you can just utilize the things that are important. You can see if it's been carried forward from a previous visit. So we can either automatically carry it forward, or we also have this copy button. So if you're treating them for a follow-up for the same injury, you can just pull forward what you already did and it'll be yellow here, and then anything that's gray will tell you that something has changed. So you can quickly and easily see what has changed since the previous visit. And then we also have this little note section at the bottom, so you can also store macros within the system. So if there are things that you say over and over and over again, you can just come in here, have those in categories, check that information. It can be up to 1,000 characters of information, and quickly do that data entry. We also have the ability to store ROS. You can also have the patients complete that in a patient form, so your staff doesn't have to. You can also just have your ROS positives show on your face sheet, so providers can kind of skip the screen unless you need to come and put any notes in. The physical examination section, we can have physicals that are related to a specific body part. So kind of lumbar examination that is just specific here. Let me move the rest of them. So we have a lot of different orthopedic tests related to a specific body part, or you can have a more comprehensive physical examination that shows multiple different organ systems. You can determine if you want each of the bullets for that particular system to show separately like this, or I personally prefer to have one long template, just makes it easier for documentation. One of the nice things about this is that you can preview what's going into your progress note at any time by opening that over here in this little third panel. This is also incidentally if you're doing telemedicine, where your telemedicine visits would happen. So you'd see a big picture of the patient here, a little picture of you, kind of like Zoom. You could pop this open, move it to another screen, so on and so forth, and still be able to document over here. But if I want to see my progress note while I am documenting, when I check this top box, it's going to mark all of my physical examination elements normal. When I save, it will populate all of that into my progress note. So I can see exactly what's being put in here. Based on that, I can come in here and I can add any additional information. So you can save additional information under these little binoculars here. And when I do that, it updates my progress note. It puts anything that I've marked abnormal in red there. Again, that can be tweaked and set up based on the body part. So based on this being an ankle injury, I can have my foot and ankle exam show up in this area, or a full physical exam, depending on preferences. And we even have the ability to have different templates for different providers based on your preferences there. From here, if I need to order anything like labs or radiology, we have a couple different options for that. We have this order sheet functionality, which gives you the ability to order labs, consults, radiology procedures. We also have this order set functionality, which gives you the ability to order multiple tests at a time. Doesn't look like I have anything set up in here actually. And then you can also, if you don't want to do that all in one big order sheet, we can add on the table of contents over here, just lab, just radiology, so that you're just looking at those particular things and not adding a bunch. But this is intended where the providers can come in and say, okay, I want to order these things, and then all those orders would show here. You could also order your physical therapy as a consult and then document that the physical therapy is done in the consult. So anytime you put in an order here, it adds an order to basically this inventory list of orders. So this is all of my open radiology orders for all patients. This is all of my lab orders for all patients. So when you order this lab, it puts it here so that someone can track whether that lab result, whether that radiology result has come back to you. So it changes the status here when, if you, for instance, have a lab interface and it comes back into the system, it'll change it to R. If you have a consult and you attach the consult records, then that will change it to R for results or for records. So it will track in this list for you, and then you can utilize that for reporting as well as to kind of see when things are done. We can also add additional columns here. So for procedures and things, if you need to do pre-authorization, we can even add the pre-authorization number as a column in that, so you can see if it's completed and that sort of thing. So a lot of people use those as kind of active reports that they're working on for all of those different types of items that have been ordered.
Any questions so far?
Yeah, jump in if you have any.
Bob, are we doing okay?
I'm sorry? Yes.
Okay, are you able to follow everything? Is it to the direction that you are wanting to look at, or are we way off? Could you guide us?
Well, I'm going to have to go through it a little slower with recording if I can get that, but yeah, let's continue.
Okay.
Okay.
Thank you.
Okay. Alrighty, so prescription screen, we are integrated with SureScripts. Behind this med history button is their last 12 months of prescriptions that have been filled by their pharmacy. So the name, address, and telephone number of both the provider as well as the pharmacy. You can also pull open the past prescriptions that you have prescribed and just click this plus RX button, which then puts them on your prescription here. So if you're refilling medications, you can easily just pop those on there. You can even train your staff to do that for you. You can store their preferred pharmacy within the system or also put that in the demographic screen so you can have that as part of their kind of new patient process. When you are adding a new medication to a patient's chart, when you click the plus button to add the medication, it's going to pop open a preferred list of medications. This list automatically populates based on what you have prescribed and how you have prescribed it. So this list is medications that I have put into the system in the past along with the dosage and everything. So I can easily come in and add an additional medication to this patient's chart and then come in and change anything that I need to based on this particular patient's needs. And then I can update it, save. If there are interactions with medications in the patient's chart or also within their allergies, which is down here in this left-hand section, it will give me a pop-up and ask me if I want to ignore it, override it, or correct it. Once I do that, I can then hit the e-prescribe button. We do also have eligibility, which will show you the patient's out-of-pocket responsibility for the medication. We'll also tell you if a pre-authorization is required, and if there is one required, you can click this button to enable that process and do it all electronically within the system. So it gives you the ability to, without even having to put in the patient's insurance information, to see exactly what's going to be responsible for that patient. You can also do order sets for medications as well. So if you need to prescribe multiple medications in conjunction for a specific condition, you can put those in as an order set and then prescribe multiple medications at one time. Last few screens in here. So we have our E&M codes within the system. And now that the 2021 codes have become a little more simplified, we no longer have to count up all the physical elements in HPI and everything that's been completed. We basically are going by medical decision-making complexity. So this just gives you a little workbook, which is basically what's in the E&M coding book to tell you based on different parameters what you need for that particular medical decision-making complexity. And then we also have our time factor over here as well. So if you want to give a summary to argue for the time factor rather than the medical decision-making, you can put that information here. You can also store phrases in there for things that you say regularly, like we spend more than 50% of the time counseling, yada, yada, yada. You can store that information right there. So once you have picked your E&M code, then it adds it to your assessment screen. And in your assessment screen, you will have any ICD codes that have been added from the complaint. So if you need to add additional, it's the plus button again. And this is going to again give you a preferred list, which is based on the things that you have prescribed regularly. So you can come in and add additional ICD codes here. You can also search for all the ICD codes in the world and pick additional ICD codes that are not in your preferred list. And if you want to add those to your preferred list, then you can add it by clicking that little plus. Each of your ICD codes can have their own plan. And if you have information that you want to have showing in here as a standard practice, that information can be here automatically for you. You can also utilize the phrases section to quickly add additional information. And then we also have an educational material in here by Merck and Medline Plus for each of the ICD codes that you can send via portal, print, or email. And then on this tab, we have all of our CPT codes. So I had documented in here some specific work comp information, my E&M codes. I think I put an injection in there. And so all of those CPT codes that I have utilized for my documentation also pull into this screen for me. One other little area to notate that I skipped in my little workflow there is the OccMed section. So I know that you guys will be in need of the Texas Workers' Compensation forms. We have those loaded in our library, so you can add them in this area, and it's this template-based format, or it's also very similar to the DOT, where you can have that in the doctor form format. So these are basically the same thing, but just documented in a different input and output. So whichever you prefer to utilize, we can set that up in your database. Or if you have providers who prefer both, we can have both in there for you. Also within this OccMed section, any kind of procedures that you do within your facility. So this CPT code got added to my assessment screen there. You can have your procedures documented in this area, and when you hit the preview button, it gives you an operative or narrative node, and that can be formatted to say whatever you want. And in any of these documents, we obviously put your practice logo and your practice name here at the top, and you can control what that output looks like. So in this section, each of these things have their own document, or can have their own document output for different types of splinting, laceration repairs, any kind of DME items. We have lots and lots of different options there. We also have OSHA 301 forms and any of the kind of OSHA related information if any of your employers need help filling that stuff out as well. At the end of your encounter, we have our encounter close screen, which can remind you if there are things that are open, if you want to keep the encounter open to make sure that those things get completed, or those can be done by your staff, so you don't have to worry about it. You can create the claim and leave the encounter open if you need to continue to edit, or you can mark the encounter closed if you're finished, and then it will take the claim, either one of those being checked, and make it ready for the billing staff. So it will basically take all of your ICD codes and your CPT codes that you have loaded into your encounter based on your documentation and put it out for them to be able to scrub that claim and either submit it to work comp if it's insurance, or create the employer claim or the employer invoice if it's employer related. So that is essentially the work comp and the pre-employment examination area. Did you guys want to take a look at the PT documentation today as well?
Sure.
Okay, perfect. All right, let me close this one, and I've got that open. We have it in a different specialty library here. Okay. So PT is a little bit like OccMed in that we do a lot of customization. Obviously, I heard 10,000 different exercises that you can do for PT and things like that. So we do a lot to kind of tweak it and make it, user-friendly based on your documentation. And also, documentation for PT with work comp is vastly different than, Medicare or any of the commercial carriers. So we obviously want to take that into account as well. So in your PT visits, we essentially can have different encounter types for PT, and they can be different colors on the schedule or set up any way you want to make it easier to see what type they are. We can also, like I mentioned, schedule those in blocks, and then also have a lot of practices will utilize that health maintenance section, which I don't even have on this face sheet, to remind you when you need to do like a reevaluation and things like that as well. So on the PT side of things, we have, again, a couple of different options for documentation. So we have the ability to kind of document a lot of different things within this specialty area in a template-based system. So if you want to kind of do everything based on body part, you can document. So this is all the exercises that were done in a day, as well as modalities performed and things like that. And we essentially bury the CPT codes associated to the different modalities and things that you're doing here, so that you're just documenting quickly what you did for that patient, for that body part. So those are kind of the daily PT. Then on the daily SOAP note, we have, I'm trying to find it in here. I don't think I have it loaded in here. Let me pull that open. So we also have the ability, I need to remove a couple here apparently, to see within the system the evaluation kind of all in one screen, or you can also have that related to the body part. So this one has evaluation by kind of multiple body parts, even has cognitive review, objective findings. So this is basically loading all of this for multiple body parts and giving you additional choices once you click on that area to go into the additional body parts and do some specific things. So that is the template-based version. What is popular as well for PT are the doctor forms. So we have some formatted SOAP notes that have all of your different modalities and things documented in here. We also have, here's another version of the daily PT note, which gives you lots of different options, not as details in terms of the exercises and things. So we can add that if you need to document all the way down to the actual exercise that you performed. This one just kind of gives you a little more basic kind of, you did exercises. And there's some area in here of some specifics. And then we also have the evaluation in here as well. So really similar to what's in the template, but in a different input format. So their pain scale, the location, functional limitations, work status, occupation, posture, edema, gait, all those standards, and your flexibility and range of motion, and then also your kind of codes that you're put in to the system there. So essentially, depending on how you prefer to document, we build those either in the template area or in the physical therapy. A lot of these different components like vitals, HPI, ROS, you can choose to utilize, you know, for instance, the physical examination area. You could have one, you know, physical examination here for PT that, you know, a lot of times they like to add a lot of different orthopedic tests and things, even in addition to the medical providers. They can have their own physical examination, or we can put it all into the specialty area so that they're kind of doing everything all in one template like this one is. So again, totally your choice on how you want to set those up. Any questions? All right. Let me flip back into, let me go to our sales database. So in terms of billing, do we have anybody on the call today representing the billing department or wanting to do kind of a deeper dive into the billing area, or do you want me to just kind of give a general overview of that? I'm not sure how everybody is on time, so I want to make sure and address anything you guys have left if anybody needs to go.
Yeah, let's go into the billing a little bit.
Okay. Alrighty. So I know Ramesh had mentioned to me that you guys wanted to be able to track collections by the biller. And we have a lot of different ways to do that. So I'm just going to kind of give you a basic overview of how the billing system works, and then I'll talk a little bit in detail about that. So we have a little toggle here that goes between the EMR and the billing. We're all still in the same database. Everything is connected. It's just a different user view. And so depending on what type of user you're set up as, it will show the screen for you, you know, which you want to see. But if you want to pop over to the billing, you can see this little dashboard here at the top and kind of see what's going on at any given time, which I think is really cool. So these are all of our claims that are ready to submit. These are all of our payments that haven't been posted yet. This is what's being collected today. So copay would be like at the front desk, remittances would be electronic remittances, and the receipts would be things that have been entered, like checks that came in the mail or that sort of thing. And then you have your outstanding claims here. So we have insurance, patient, employer, and you can actually click that hyperlink and see for each of your insurances or employers some detail. This isn't the best report, but it just gives you the ability to kind of, you know, at a glance quickly see, okay, how many are Cigna versus Blue Cross. From here, this screen mimics your schedule. So when the providers are finished and either click that create claim button or mark the encounter close, it changes the status here to ready to bill to let them know that they're ready to scrub that claim. Typically, our billers don't work from this area. They work from these little kind of buckets at the top. So the way this goes is kind of patient, register, setup, demographics. This is similar to what's on the encounter side. Then from here, we start the AR process. So we have our claims. So we're scrubbing the claims, submitting the claims. Then it goes to remittances, which are your payments. So looking at the payments, posting the payments, so on and so forth. And then it goes to follow up if the payment doesn't come in. So it kind of goes in the order that your claim generally goes in during the revenue cycle management process. So from here, most practices will go to the unprocessed claims each day and see any of the claims that need to still be submitted or printed, or depending on exactly what you're doing with this, if it's an employer claim or work comp, all of those go into the same bucket and you're able to scrub them and work them from here. So I'm going to go into, do I have a work comp claim? I'm not sure if I do, but I'll at least show you kind of what happens. So when you are ready to work a claim, you go into that claim. Oh good, it's work comp. If it's work comp, it'll have this big red area over here, which will give you the ability to see the injury information that's pulling automatically from our case. We can also from here see what insurance is set up for it to go to. We can see and also add new alerts if necessary. We can see the provider's documentation, so they can come in and read anything that you put in here, any procedures you did. They can also see all of the ICD codes associated to this encounter. They can see old ICD codes that have been on that patient's encounter in case you forgot to add one that day if there were any. They can see the place of service, all of the information related to the claim, and it shows your ICD codes, your fees, your CPT codes and everything, modifiers and everything pulled from the EMR down here. We have the ability to store a cheat sheet in the screen, so if there's something they need to look at regularly, you can store that in there. It's like an Excel spreadsheet. They can also load claim scrubbers directly into the system. So if you have rules that need to be set up, so for a specific insurance company, there's an additional piece of information that you need, you can have those claim scrubbers automatically pop up and remind you of different information based on that particular insurance company or CPT code or any of those sorts of things. You can also attach in the background things like NDC codes to your CPT codes for, injectable medications or lots of those sorts of things. You can just set it up directly within the system. If this was an employer-based encounter, it would have automatically set our fees here based on the employer. So we could still see all of the related information here, but typically we're not worried as much about ICD codes and things like that as well. And it would be billed to employer here rather than insurance being located in there and having the work comp employment there. So once we've scrubbed our claim and we know that it's ready to send, we're going to click this ready to send button, and it's going to put it in the queue to either be printed, emailed, sent, however we're going to process that claim, it will put that in the queue. So typically once a day, you're going to come in here and you're going to process, or it could be weekly or monthly for employer invoices, but you're going to come in here and process your professional claims and your employer invoices. So when you come to this bucket, you'll see all of your primary, secondary, Medicare, if that's applicable, and then your primary, secondary, generally your work comp is going to come here. If you're sending them electronically, you're going to hit that process. Depending on the work comp carrier that you're, or the clearinghouse carrier that you are submitting to, you can also attach the records for that particular claim. So when we're back in that claim screen, there's actually, I don't know if we have it enabled in here. I don't think we do. We have the ability to actually pull open the claim and attach the records from that particular claim directly into this claim. I don't think we have it turned on in here. I need to make a note to do that if we can. I don't know if we can turn it on unless we have a clearinghouse attached or not, but if we can, I'd like to be able to show that. So once we have submitted our claims, if there are any that have been returned or rejected, they'll go into this bucket so you can monitor those to see anything that comes in. You can also set it up where somebody gets a message when that happens. They don't have to come to this bucket, but you can actually, change them around if you need to and resubmit them. When payments come in, if they come in electronically, they go to this EOB ERA section. And so what most practices do is they take the money that has hit their bank account for that day, and they match it up to the, I didn't mean to hit the enter button. There we go. So they'll match it up to the EOB that has come in electronically. If you know that you've received that amount and you're just ready to go ahead and process this, you can click ready to post. It will then take any payments, adjustments, and those sorts of things and apply them automatically to that particular patient's account. I don't think there's as much on the occupational medicine side of things as, say, primary care, but if you did have a secondary insurance in play or something like that, after the insurance company pays, if there's any patient responsibility and there's a secondary in there, then it'll push that automatically to the secondary insurance. Otherwise, push it to patient responsibility. Again, not something that applies much on the occupational medicine side of things, but the functionality is there if you need it. You can also from here, if there are any that have been denied or anything like that, you can actually take action from here. So you can put the claim on hold, you can appeal it, you can resubmit it, you can basically set that up to re-queue to come back and reprint and resubmit if you need to later, that sort of thing. So you can work the claims in the payment posting process or deal with those later and follow up. And from this screen, you can see a lot of different things like the provider's notes. You can see the EOB if it's attached. You can set up an alert. You can see any payment information in there. There's lots of stuff that you can see with all these little icons directly here within this screen. So you're not having to jump around a lot looking for information while you're posting. We also have the ability to, if you collect any patient payments, to come in and they basically put those go into kind of a holding bucket, and you can come in here and post those to the patient's accounts to where they need to go to. Here is where you would go and you would post any, and I don't know if we have any employer, we do have some employer payments loaded in here. You can come in and post any employer payments that come in. So when you add a new one, it will give you the ability to select the invoice for that particular employer. So you just search by the employer, pick the invoice that comes in. If there are payments that come in from the employer portal, it'll tell you the invoice number. So you just pick that invoice number, and when you save it, it'll apply that amount to the patient's or to that particular invoice. And you can even dictate whether there's a different allocated amount versus the billed amount and that sort of thing. We also have a few other little things in this area. So things like, bulk write-offs or any kind of miscellaneous credits, not again as applicable in occupational medicine. We do occasionally need to transfer a balance from one patient to another. Maybe the employer paid twice on one patient and they want to, accidentally, and they want to give that credit to a different patient. You can transfer that. You can deal with return checks, refunds, things like that in this area. And then past the payment functionality, we get into following up on claims. So this is where your tracking of collections would typically come in. So my favorite screen in this area is our outstanding claim screen. This is all of the claims within the system with any balance to them. So you can see that we have 205 claims for $51,000. I can then take this screen and filter it any way I want to. And there's lots of different kind of canned filters that are already in here, but you can save your own. So this one, I created my own and said, all right, show me everything that's 120 days old and the insurance has the word blue in it. And so I'm able to just filter down to essentially what's my Blue Cross claims. And I can get really specific and say I want it to be Blue Cross, but I just wanted a generic one. So from here, I can take all of these claims and I can assign them to someone to work. So I can come in here and I can say, okay, I want Amanda Bailey to call the insurance company. And this is all of our revenue cycle management company, kind of the notes that they use, but these actions and everything are customizable. So you guys can determine kind of what you want to put in there. I can give it a due date, and I can even send them a message in the system, remind them that they have this. Once I've assigned it to that person, it then goes into their assigned task bucket. So they can come in here and see all of the tasks that are assigned and all of the list of tasks assigned to them. From here, they don't even have to click into the claims to work some of them. They can click this little button and see the phone number. So if I'm contacting employers or I'm contacting patients to collect money, I can come in here and see the information there. I can also from here submit and create an appeal letter. So you can create different templated appeal letters, come in here and attach EMR documents, come in and attach billing documents if necessary. if the person I'm sending it to is already loaded in this person's insurance or attached to their demographics in any way, it would automatically populate that, but I can put in name, fax, email, address, or fax number. When I save that, I can fax it, I can email it, or I can print it if it needs to be mailed. Once I create this, it's going to save a record that I created this appeal letter in the patient's file, as well as in that encounter, in that claim, essentially. So once you have created tasks, they can come in and they can report on what they did with it. So you can have different information to drop down to make it easy to report on what was done. So I collected it, or I left a message, or I refiled it, or I appealed it, or we've got to do peer-to-peer review, that sort of thing. You can document that, add comments. There's also kind of a status on where it is. And this is, again, something our revenue cycle management department uses. They have a lot. And then I can track when I did it, and then also when it needs to be followed up on. And based on this status, I can set the follow-up date to be automatic, or I can also forward it to another person if I need to. So once this information has been loaded in here, I can then see that information and that status on my screen here, and then I can generate some reports from it. So I can actually dump this to Excel if I want to, and then we also have reports, and we can customize these, what we call tabular reports, based on different parameters. So, you know, who collected it, then, you know, who worked on that task. And you can even, you know, make it based on insurance company or employer or lots of different areas. So definitely easy to track who did what, assuming that they document that piece of it in the system. And there's also ways to track by like who modified it last and that sort of thing if you don't want to have them manually put those tasks in there. From here, we also have the ability to assess denials. So these are all of the CPT codes that have been denied, along with the reason for it. So you can analyze, again, not as common in OccMed, a little bit on the work comp side, but it's not quite as you know, a problem as with commercial carriers. You can set up payment plans, again, probably not as applicable, but it's there. Outstanding letters can be generated both to employers as well as patients. If you send any accounts to collections, this kind of gives you the ability to move that AR off of the patient responsibility or insurance responsibility to kind of a separate bucket, so you can track that and then post payments as they come back in. Over on the remittances side, you can document collection payments. And then from here, we have tons of reporting. So our reports, while they're not quite ad hoc, they do give you the ability to edit the layout and kind of save your own. So for instance, this is just a claims build report. If I click this layout here, I can see what the columns are here, and I can move those around. I can remove them. I can put them in a certain order. I can graph them. I can group them by different things. So there's lots of different ways to kind of set that up, and then I can hit save as and make a new report out of that. So I can kind of create my own different reports based on different parameters, and you can restrict those to, you know, a report for each employer, a report for this group of employers or state of employers, or lots of different ways to kind of slice and dice. And those can be done by claims, by charges, which is all the way down to the CPT code rather than by the individual claim. And then you've got the same thing on collections. And then you've got things like distribution, summary, agings, ledgers, which is a specific patient's charges, payments, adjustments. You can generate statements. You can also run a financial analysis, which kind of gives you like your charges, payments, adjustments by provider, by location, by month, lots of different ways to kind of look at that statistical analysis. And then we also have some dashboards for both the EMR as well as billing. And you can kind of determine what information you want to go in here. So we have kind of these are some of the reports our RCM uses, looking at distinct patients or new patients over a period of time, month-end reports for different payer mixes. We don't have a ton that we've actually built in here, so it doesn't show a ton of data, but it at least kind of gives you the idea of different information in each of these cells, different types of graphs, and you can have up to 9 different dashboards in both the EMR as well as the billing section.
Monica, can you quickly show employer portal, I don't know how much time they have, but Bob was
Yeah.
very interested in looking at that.
Absolutely. Alrighty, so on the employer portal, when we log in, again, this is based on the user who's been set up and what they have been given access to. So on that employer protocol screen, we had the 4 different tabs of things they could be given access to. So if they don't have access, that drop down won't appear. So these are all of my documents that I have shared for Aero Industries. I can filter that so I can see everything for a specific patient or all of a specific document type here. So I can filter that. I can search for the patient. I can just click the little view to actually open up that document. On the billing side of things, I can see the invoices. So I can go back and look at all their old invoices, payments, aging, and then we also can have them make a payment. So this is their aging and what's due. So they can come in here and click that pay button and pay with credit card. We can also see the list of the users that is assigned, so they can come in here and do their own user management if you want to allow them to. They can add a new user, new department if necessary. And then the employee management is where we have the list of employees for that particular employer, so they can see the employees, they can mark that they're inactive if they need to add notes, and then they can add a new employee if necessary. So once they add this employee, you'll get a notification they've added a new employee, and it creates a record in your system for that employee. So if you're doing drug screen randomization for that employer, it will pull all of their employees, including the new one that they just added in the system.
Is this also mobile friendly?
I have not looked at the employer portal on a mobile, but I don't see any reason why not. I've actually, when I was a customer, I used the EMR on my phone all the time. So this actually is a little bit bigger screen than the EMR in terms of there's not as much stuff on here. So I don't see why not. Most of our software is built to it shrinks down based on your screen size and adds bars at the bottom to make it so that you can, scroll over if it's on a smaller device. So I don't see that that would be a problem.
So is this the view the employer would have, or is this our view of the employer portal?
This is the employer view. So I'm logged in as an employee of Aero Industries who's been given access to this information.
I see. So will the employer be able to see all the drug results of all the patients they've sent, let's say?
If you want them to. So we have a couple different ways for that to be set up. You can share them manually if you don't want them to get all of them, or you can set them up to automatically share when the results are in the system or you've approved them. So there's a few different parameters on that. I know with like MRO services and things, sometimes that's something that needs to be segregated, so you can make choices on that based on your specific needs.
So you can put the results of the physical, the results of the PFTs, spirometry all in there?
Mm-hmm. Yep. Mm-hmm. So here's a spirometry here. Let me take a second for my, there we go.
So the system can be set up in a way that, let's say that when a drug screen results come in, you want that to be automatically shared, it can be shared automatically. But if you say that, no, first someone has to review and they have to share it manually, it can be set up that way also. Same way with any of the tests that you do, based on the properties that are being set, the system will, behave accordingly. Now here you are seeing there are DOT, there is a OSHA, there is a drug screen, and there are for different patients. All those can be filtered based again on what you are wanting to look at. So I know, Bob, you asked about the question about scheduling from the portal. So that is being worked on. Currently, we don't have the scheduling from the employer portal yet. We also have like the patient portal and the referring physician portal for like specialty clinics. So in that, we do have the option like the patient requesting an appointment from the portal, or in a referring physician portal, a referring physician requesting an appointment. The same functionality has to be extended to the employer portal. That is being worked on. So she
And does
just
it
logged
list
on to
the employer there?
Available in Spanish.
Yes, you can have that in Spanish. Basically, the forms and all that you're looking at that the patient wants to fill it out, you can have that available in Spanish as well. In fact, from a Spanish, perspective, we have close to 200 clinics in Puerto Rico that use our product, and they use it, the forms and all, everything in Spanish there. I mean, even in your education material that you share will be available in Spanish if you want that to be.
Okay. I don't. I thought I had one in here in Spanish, but that's in a different database. So this is a general view of the patient portal, and established patients have a little modular view, and you can decide what of these you want on or off. So your surveillance examinations would be health reminders, appointments are here, messages if you want to allow them to send and receive HIPAA compliant messages. Generally, the patient's accounts are not an option or an issue for occupational medicine, so we can turn that off. And then if there are other things you want to be, allow them to be able to do, like refill medications, see their records. Here's where the educational materials go. So any of that that you share with the patient will be available for them. And they get a notification when you add something new to their email to let them know they need to log in and look at it. You can also have the patient sign, fill out the patient form, as I mentioned. You can also have them sign legal documents. So your HIPAA consent form, they can come in, they can sign it, and then submit it back to you, and it'll go directly into their chart. You can also utilize what we call PrognoCIS, which is a tablet-based system just for capturing signatures if you just need to do, a quick signature capture for HIPAA consent forms at the clinic. And then we also have Pro Check-in, which is a tablet-based system where you could have the patient actually arrive themselves for their visit and then go directly to your patient form. So you could have a tablet, have them fill out your intake form right there at the clinic without having to log into the patient portal. They just put in their name, their date of birth, and it takes them right into their account.
Yeah, I understand. We end up filling it out for them most of the time.
I feel your pain there, definitely. I was at a pain management practice for a long time, and they were used to these paper forms that we had them fill out for years, and we made the patient forms look just like those paper forms, and they actually did pretty well with them. But if anything looked anything different from a paper form, they would just look at it and cross their eyes and hand us the tablet back. Or they would answer the first two questions and say they were done. Anything else that we haven't shown you guys that you can think of that you want to take a look at?